I think in an ideal world, having the pediatricians and the specialists and everyone sort of working with the surgeons and the families to really project for every kid what the short and long-term health trajectory of that child is going to be like, with or without the surgery. And getting into discussions of survival and quality of life and all of that. And sometimes that trajectory is more obvious, especially if you're in the setting of a neurodegenerative or some type of catastrophic underlying illness, that the likelihood of it unraveling and becoming more severe and making the child more fragile over time is so clear. And then you're thinking about, okay, so how does spinal fusion and all the other treatments that children are receiving sort of play into that? Are we prolonging a quality of life that we feel is not that great? Would it actually lead to more comfort and a better quality of life, even though the trajectory may be going downhill? I mean, these are so complicated things to think about and project, and there's so much uncertainty in that. But I feel like every child sort of needs to have that at least attempted to portray out there to see what might happen.
And also for families to have the opportunity to really think about that and think about, what quality of life means for them and for their child. And I think those are the situations and the times where it's most important for the medical team to be on board with the family's decision, and oftentimes maybe even offering some support to share or describe that and help other people in their world understand that. I think that there's sometimes we have care providers coming in and out of our home, therapists and nurses, and sometimes if you make a decision like that, there can be many voices happening. And for someone to keep revisiting an issue that the family is solid on and feeling good about and at peace with, it's really important that the team as a whole comes around and embraces that. And any way the medical team can provide a sense of expertise and acknowledgement that this is okay, this is an okay decision.
We've been talking about families and reasons to not do surgery, and as you point out, one of them is that life expectancy or a degenerative process is such that it simply doesn't make any sense. Another thing that I've encountered is an attitude that, particularly in severely impaired children, that we're putting the child through something that is undoubtedly painful, and although we do our best to give pain medicine, this is a very unpleasant experience for the child, and that the family is simply not able to explain to the child why they are doing it, and they're really not able to comfort the child either. And some families perceive that as just unacceptable, and even though the child may have health detriments from the progressive deformity, they cannot imagine putting their child through something that severe and that awful without being able to somehow explain to them. And I think that's a very legitimate reason to not do something that is invasive. And so we talked about supporting families that decide to not have surgery. That family needs supporting because, as you point out, all the caregivers are going to come and go. When a new physical therapist comes, they say, "Why haven't you had a spine surgery? Can I hook you up with a doctor who will do the spine surgery?"
Maybe you just haven't heard the right words.
Yeah, that's right. So it's important to stick with those people and help them and support them. And overall, overarching caregivers like CCS do a good job of that. Palliative care does a good job of that. But the individual specialists don't necessarily do that. We're organized toward doing stuff, and so we have to hold off.